Welcome to the third international webinar of this year, organized by Vets and Clinics by Advance. My name is Alba Martos. I'm the International Vet Manager of Affinity Pet Care, and today I'm very happy to be here with Fernando. Good afternoon, Fernando. It's a pleasure to be here with. Thanks for being here with us. So first of all, I would like to present Fernando. Fernando is an European diplomate in small animal reproduction, and nowadays he's working in San Fernando Vet Clinic in Palma de Mallorca. And there he is combining the general practice with his specialty, which is reproduction, as I said. So today, I invite you to take advantage to ask him anything you consider. And you will see that at the end of the session, we will answer all your questions. But anyway, we don't have enough time. Here below in the description, in the same YouTube page, you can see an email where you can send all your questions and Fernando will answer them. On the other hand, before starting, I would like to remind you that you can also download the presentation. You have the link here also in the YouTube description. So clicking on that, you can obtain the PPT that we will show you during this webinar today. I will not delay any longer, and we will start the session. So as I said, we will talk about sterilization in dogs and cats. So Fernando, first of all, I would like to ask you, why do you consider that it's an important topic to bring to this session, and also the main advantages of sterilization in small animals?
Well, first of all, I would like to thank Affinity to give me again the possibility of discuss of such an important topic about sterilization, because all of vets, we are sterilizing dogs and cats at our clinics, and it has been classically considered that the sterilization is good for cats and dogs. However, for the last years, there is an increasing interest on the insidious disease that we can found in sterilized dogs or cats. And when you read the literature, you can feel how there are preconceived ideas by the authors and also by the owners. So it's a difficult topic for that. And the problematic is that the results cannot be extrapolated between the breeds, the sex, and even when the age of gonadectomy. So it's a difficult topic to discuss about it and to have ideas. Also, the relative risk, it really depends on the prevalence of disease. I mean, it is not very important if for example, hypoadrenocorticism, there is an increase of that disease of per 2, because how many Addison disease we see in general practice, maybe 1 per year or maybe 1 every 2 years. If the increasing prevalence of that is the double, we will not feel it. However, there are mammary tumors, for example, that there are an increased prevalence when in entire dogs. So we have to all that to keep in mind. And also, when you read the literature, it is difficult because some papers are discussing about they say early sterilization when they are prepuberal sterilization, and others are early sterilization before the 1 year of age. So that difficults the interpretation of the literature. We must always keep in mind that the main objective of sterilization is to avoid unwanted litters, because that is absolutely essential to control the population around the world. And think that it is not the same first world country where most of the dogs are medicalized, and an important part of the cats, than another country. So it really it's important to keep in mind that in many cases that it's necessary to spay them. This decision of to spay or not to spay, it's only for medicalized dogs living under control. For example, in Spain, there are every year there are about 100,000 dogs and 30,000 cats that are taken in kennels and shelter per year. And from where do they come from? So they come from, most of them, they come from the countryside. Dogs are not under control and they have litters. And then many of them also, they have behavioral problems. They may be aggressive or to have some kind of anxious disease or something like that go into the kennels or the shelters. All these dogs should be sterilized. Then also I work with breeders every day, and I would like to say that irresponsible breeding maybe it's possible, but it's not. It's really not the typical, or it's not what we will find in rescue kennels or shelters. Irresponsible breeding, I would say that it's nowadays it's not. We don't see it. So finally, the main problem of population control is the irresponsible owners. So all the dogs that come from shelters or they live or they have an outdoor access should be spayed independently of the disease we will talk later. So the first of all is the control of the sexual behavior. So that is absolutely important. It's the main reason to castrate a dog. Is to eliminate the hypersexuality, urine marking, excitement in the presence of females in estrus, or the hormone-associated aggression between males. And finally, the grooming. Of course, for the female is also important to avoid the heat or unwanted reproductive behavior as bleeding, estrus behavior, or the pseudo-pregnancy. Then there is a clear and known by all of us prophylactic effect on the female genital tract. Pyometra or glandular cystic hyperplasia is an hormone-mediated disease. Infectious is secondary, and it will affect between 10 to 25% of the intact female dogs and about 2% of non-spayed cats. So it's a disease that we will prevent if we sterilize the females. For the mammary tumors, 25 to 4% of intact female dogs will develop mammary tumors around during their life, and 50% of them they are malignant. So are clearly they will compromise their life, and the preventive effect of the sterilization is absolutely sure. It is said that there is almost no risk if we spay them before the first hit. Then between the first and the second, it's said that it's about 7% of bitches will develop mammary tumors, and after the second hit, it's the percentage, it doesn't change. It's about 25%. However, these percentages that are very classical now they are considered not updated because it is clear that if you spay a bitch before or at the age of 2 years, it will have a preventive effect independently if it is the second hit or the third hit the earlier they are spayed, the better it is. And because the mammary tumors have benign mammary tumors have receptors for progesterone and estrogens, so the reduction of the presence of that tumors will be reduced independently of the age of sterilization. Regarding the cats, it's 70% of the cat. 17% of the cat tumors are feline mammary tumors, and most of them they are malignant. So it has also a preventive effect, very important, especially at young age. But all the time it has preventive effect. Also, the mammary tissue, lactation, about more than 60% of the females dogs will have lactation due to pseudo pregnancy in their lives, and it predisposed to milk retention cysts, to mastitis, and even to mammary tumors. So it's something that we will prevent with sterilization. Feline fibroaderomatosis is also a hormonal disease that will not appear anymore if we sterilize the cat. And also, of course, if we remove the ovaries, there will not be any more cysts or ovarian tumors, vaginal or uterine tumors. Most of them, they are benignant and hormonally dependent, so they will not appear anymore. Vaginal hyperplasia also will not be there anymore after the sterilization, and it's especially brachycephalic breeds are predisposed, and some bitches will develop urinary tract infection after the estrus, and in that cases it will not appear anymore if they are sterilized. On the male genital tract, benign prostatic hyperplasia, it is a histological lesion that is observed in more than 90% of the dogs by the age of 9 years, and it will predispose them to prostatitis, to prostatic cyst and prostatic abscess. However, only less than 1% of these dogs will develop clinical signs of disease. So it is something that it's true, it's there. All the males are predisposed, but finally the prostatic disease or prostatic syndrome is not so often observed. Once again, if we remove the testes, there will not be tumors anymore or testicular disease, orchipedidymitis, spermatocele, testicular torsion. It's especially important to castrate the cryptorchids because they have a clear increased incidence of tumors, and also not only that, also because the tumors that they may develop in cryptorchidism, maybe most of them is, or it's even all of them, they are sertolinomas and or seminomas, and they have a little bit more risk of or feminization syndrome or to be malignant tumors. So that will be prevented with the castration. Other advantages, dogs with or females with idiopathic epilepsy will see reduced the frequency of seizures if they are spayed, and then diabetes is reduced with spaying because there is no progesterone anymore, and perianal tumors is a condition that will be healed after castration in the males, and perineal hernia is not observed or almost not observed in castrated dogs, and the castration is part of the treatment of that problem. Moreover, castrated dogs live longer, about 13% more, and sterilized female dogs live also 25% longer than a non-sterilized female. And why? It is said that in case of the sterilized dogs have more incidence, well, the cause of death is more because of tumors or immune-mediated disease. And they see there's a reduction of the incidence of traumas, infectious disease, vascular and degenerative disease. But that is more related because they are not free, because sterilized dogs are medicalized dogs, most of them, and they have less access to outdoor, and they are more treated with anti-parasites and whatever.
Okay, thanks, Fernando. So we have seen that the sterilization in dogs and cats has a huge number of advantages, but I would like that you can share with us which disadvantage it has, because I'm sure that sterilization has also some disadvantages for dogs and cats.
Yeah, absolutely. First, well, of course, after sterilization, it's an irreversible. After gonadectomy, we should say, it's an irreversible. So if the people is thinking that they may want to have a litter, let them the possibility. Don't spay them so early. Then there are some hormonal considerations. Let's say that a bitch has is in heat every 6 months. Then she has digesters for about 2 months. So it means that they are exposed to about, for 1/3 of their life, they will be exposed to the sex hormone. So it's very long. It's an important exposure to that hormone that for sure they are very powerful. Just a small look to the hormonal control of the reproductive control. Hypothalamus secrete generates that has an act on the pituitary gland, and it secretes gonadotrophins, FSH and LH, that will have an effect on the gonads, secreting estrogens and progesterone in females and testosterone in males. When they are gonadectomized and we remove the gonads, because of the absence of the sexual hormones, there is not anymore the negative feedback on the gonadotrophins and on the generates. That means that the level of FSH and LH is very, very, very high and continues forever all the life of the animal. And it has been observed in all the species, or in cat, dogs, and people, that there are generate FSH and LH receptors in a lot of the tissues in the body, in the brain, in the genitourinary tract, in the skin, thyroid, musculoskeletal system, everywhere. So it is not clear why they are there, but for sure that if the animal has a high level of gonadotrophins forever, it has an impact on these receptors. So obesity is the first important. It's very often we see obese dogs or cats sterilized. And in dogs, it has a prevalence of about 20 to 40% of them. I would say that more. Female obese dogs are more frequent than male dogs. And the risk is especially important for the first 2 years after gonadectomy, regardless of the age of sterilization. Why that happens? So because there is a reduced catabolism by 40% to 20 to 40%, depending on the dog and especially on the breed. You know that Labradors and Beagle are clearly more predisposed to obesity than others, and also there is an increased appetite. Why? Because they have an inhibition of the satiety. And it's pretty curious. Leptin is an hormone produced by the fat, who has an effect on the secretion of serotonin. Serotonin comes from the hypophysis. But obese dogs have a leptin resistance. So serotonin does not work well anymore, and it's the hormone that, between other things, it has a hypophagic effect. So obese dogs have increased appetite because of that. And also, there is cholecystokinin and glucagon on the level of the digestive tract that is increased in that dogs. So, and make them to have this inhibition of satiety. And in the brain, hypophysis, and also in the digestive tract, there are these receptors for LH. So there may be a relation because with that. Consequences of obesity: increased sedentary lifestyle that predispose them to joint disease, cardiorespiratory disease, metabolic disease, and reduced of the quality of life and lifespan. Of course, obesity is not only because of the sterilization. There are lots of things, and I think we have to educate the owners to have a good practice to feed their animals, control the feed and good hours, etc., etc. Then there is the post-spaying urinary incontinence. It's also very known for us. There is in these spayed female dogs have an incompetence of the urethral sphincter that it's present in 3 to about 20% of the females, and it's mainly in dogs of large breed dogs or large dogs, more than 20 kilo. Especially predisposed the boxers and also Doberman, Rottweiler, Irish Setter, etc. In males, it's also possible, but it's very rare. The big difference between the urinary incontinence after spaying or after castration between dogs and between males and females is that the females should appear later, about in 2 to 3 years after the sterilization, and in males it comes very short time later after the castration. Then the joint problems, of course, they are absolutely multifactorial. It depends on the breed, on the genetics, on the activity of the dogs, if they live indoor or outdoor, if they are overweight or not, etc. But there is a presence of LH receptors on the cranial cruciate ligament, on the round ligament of the femur, on the femoral head. So that also makes think that there may be a predisposition on this disease. So in general, we can keep in mind that sterilized dogs are predisposed to generate joint problems, especially in the case of the early sterilization. Regarding hyperdysplasia, male in Labradors, it has been observed that castration does not increase the risk. However, in female Labradors, there is an increased risk of hip dysplasia when they are sterilized very younger. So there are differences in the male and the female of the same breed. And elbow dysplasia is almost not observed, well, after that publication, is not observed in intact males, but the males younger than 6 months old when spayed or castrated has a 4% of incidence, and between 2 to 8 years, a 2% of incidence. And in female dogs is not observed, there is not an effect of gonadectomy independently of the age. So look at the difference between hip dysplasia and elbow dysplasia and females and males of the same breed. So it's really variable. The cranial cruciate rupture is well, there are some publications saying that sterilization increases the risk of that, particularly if they are spayed or castrated after early at young age, and also obesity. It says that it's predisposed to cardiac cruciate rupture, but it's not the sterilization per se. So, for sure, obesity it is, but is it only for the sterilization? It's unclear for the moment. Dermatological problems. There is the puppy couch syndrome. Publication says that 20% of dogs has that problems. It is it's when you feel that the coat of the dog becomes like in a puppy, and it is especially observed in some breeds. I would say that the most typical is the cocker. For sure, you have also already seen cockers, spayed cockers, that the hair is not so beautiful and than in entire dogs. I would have never said that it's 20 affects to 20% of them, but it's also things that you can see if you pay attention. Atopic dermatitis, it has a lot of factors varying that age, the sex, the breed, even I would say that your distribution also, because here in Mallorca it's very typical, and I would say that more than 2% of dogs they have that. But well, it has been associated with gonadectomy in 2 of the 3 studies that have checked for that. And there were studies with large populations. Immune-mediated disease, well, there is this publication that studied in 90,000 dogs, and they observed that there is an increased incidence of in sterilized patients. There's a risk of 1.5 to 2 times greater in females than in men to develop atopy, hypothyroidism, immune-mediated thrombocytopenia, and inflammatory bowel disease. The risk, it was increased, but it was the same between females and males in immune-mediated hemolytic anemia and Addison disease, and only in females the risk was increased for lupus erythematosus. This study didn't find any influence on myasthenia gravis, colitis, and pemphigus. For sure, most of these diseases are not frequent, but well, they are very grave. Other hormonal disorders, diabetes has been associated in about in 2 of the 4 studies that have checked for the effect of the relation of diabetes and gonadectomy. Well, it is associated with obesity also and progestogens, and gonadectomy has a preventive effect on the females. In cats, its gonadectomy increase the risk for almost 9 times in sterilized cats, especially because they become overweight. But then there is no relation between the age of sterilization and the diabetes. And hypothyroidism, one study says that 41% of the dogs with hypothyroidism were gonadectomized. So, and that's why it has been found an important quantity of LH receptor in the thyroid. Regarding the urinary disease, chronic kidney disease has been associated with gonadectomy in 1 of the 2 studies, but urolithiasis, it has been found that in 3 of 4 studies there's a relation with gonadectomy. For feline low urinary tract disease, well, when the cats are sterilized in puberal, they have an infantile penis and vulva. However, a study checked the urethral diameter in castrated cats at 7 weeks and 7 months, and it was exactly the same. So it has not a lot of it seems that it has no influence. Even one publication says that there is less incidence of fluid disease in prepuberal sterilizations. Regarding the tumors is complicated, but prostatic tumors are not frequent, are rare, but there is a risk of 3 to 4 increase in castrated dogs. For the bladder and urethral tumors, mainly the transitional cell carcinomas, the risk in castrated males is 3 to 8 times bigger than in entire males. And then what it has been checked the most is lymphoma, mast cell tumor, hemangiosarcoma, and osteosarcoma. In general, we can say that there is an increased risk of development in sterilized dogs. But look at this table. There is differences between the age and between the breeds, because these are the only breeds I have found that it has been clearly studied. And for example, Labradors and German Shepherds didn't found any difference with entire or gonadectomized dogs for all that tumors. But then for Golden, Vizsla, there were a difference, and also it depends on if they are males or females, and it depends on the age of the sterilization. Something very very impressive is that osteosarcoma the risk is double in castrated males and females, and in general in Rottweilers, the risk of developing osteosarcoma in non-castrated male or females is the 8%. But if the animal is castrated or gonadectomized before the age of 1 year old, 25% of them will develop an osteosarcoma. There is also an effect on the behavior. In fact, the behavior specialists are against, in general, they are against the sterilization because there is a greater degree of excitability and fear of noises if sterilization is performed before 7 months. Also in German Shepherds, there's a publication saying that sterilizing them between the 5 to 10 months are more reactive to people and animals outside the family. Also, and the most important thing is the aggression. Castrated dogs are more aggressive, fearful, and nervous. Obviously, we are talking about aggression out of the hormonal aggression, we'd say. And this study, Takeuchi et al., says that the risk of aggressions are reduced in about 61% of previously aggressive males when they are castrated, and in 53% of the aggressive female dogs, while in aggression are increased in 21% of the female dogs when sterilized. So our data a bit different of the typical what we always say, listen that the females must not be aggressive females must not be sterilized because they will become more aggressive. So that person says that, or that team says that that in 50% of the cases it will reduce the aggressivity. So a bit difficult, I think. In cognitive dysfunction, it said that the progression of the cognitive dysfunction is quicker in castrated males compared to entire males. But in that study, unfortunately, there were not enough female dogs to compare. In humans, the increased level of LH is associated with less cognitive abilities. And in fact, when the testosterone is low and LH is increased, it is involved in the beta amyloid deposition in the brain and the preclinical stages of Alzheimer's disease in humans. So finally, what we see is that there are a lot of disease that with an insidious effect on several diseases, and most of them may be related with the presence of LH receptors independently of the urinary tract, with urinary incontinence, on the joints, on everywhere we can talk about. There is the presence of these LH receptors, and that probably have an influence on the developing of that disease.
Thanks, Fernando. So now we have a big picture about the advantages and disadvantages of sterilization. So I think that now we can move to another typical question or typical issue, that it's which is the most appropriate technique that we can use for sterilization. So I don't know if you can share with us your opinion about that.
Yes, of course. It's a very typical question for the young vets, or not so young, because but in fact, ovarectomy, it in fact is the same. Ovarectomy and ovarysterectomy, the aim of that is to remove the ovaries, and without the progesterone, there is no more risk of developing hormone-dependent uterine disease. So we can say that ovarysterectomy is unnecessary unless there are visible uterine lesions. So ovarectomy, it's better than ovarysterectomy, because with ovarysterectomy there are more risk of complications, like a bigger incision, the time of surgery is longer, there is an increased risk of intraoperative bleeding, and there is more postoperative discomfort. Then also some people perform via the flank or via linea alba, in my opinion, is better to increase the risk. Via the flank, there is an increased risk of seroma, and the animal position needs to be changed during the surgery if we perform them by the flanks. So I think it's better to perform it by the linea alba. The only exception is cats with an extensive fibroadenomatosis that you cannot approach by the linea alba, and you can do it by the flank if you want. I will not give a masterclass of ovarectomy, of course, but just some tips that may help to young vets. The forelimbs can be positioned flexed to reduce the tension of the suspensory ligament. Then I love the Hawk spay for the cats. Sometimes I use it also in dogs, but especially for cats, it's very useful. If there is a lot of tension on the ovarian pedicle, you can cut the suspensory ligament, but it's important to do it at the most distal point, just on the pillar of the diaphragm, because here it will not bleed. And then I love the Miller's ligature, and that to perform that, we put 3 clamps at the level of the ovarian pedicle, and 2 others on the oviduct, on the uterine tubes, more or less, or in the at the end of the uterus. And well, I will show you a video. We cut the ovary and we remove the ovary and we place our ligature. To perform the Miller's ligature, we give 2 rounds with the ligature and we place it, and it's a auto closure ligature. We put that, we finish our knot, and just before closing completely, we remove the first clamp, that it's only with 1 click, just to erase the fat, and we close the ligature. Then we perform 2 or 3 more knots, and with that ligature, it's enough with only 1, of course, because you have given 2 rounds to the ovarian pedicle, and it's as you told you, it's an auto closure ligature. Then also we will perform the same procedure on the uterus, and that's it. You have it. Laparoscopy, it's interesting. Well, I think it's more interesting to train the people than for the ovariectomy, because ovariectomy can be done with a very small incision, abdominal incision. But well, maybe it has a bigger interest in large and obese dogs, where the surgery may be difficult.
Thanks, Fernando. So we have seen which is the best technique to sterilize a dog or a cat. But now let's move to another quite usual question, that it's when do we have to sterilize a pet? So which is the best moment to do it?
Okay, so ideally is when the bitch is in an estrus, so 2 months after the last heat. Then we should avoid the sterilization during the estrus because of the risk of lactation during the pseudo pregnancy. That is clearly more observed in female dogs than in female cats. It may be possible in female cat, but it's very rare. Mm-hmm. Then, if the female is pregnant, we can do it, because the benefits of not having this litter is more important than the possible risk that we will develop lactation. Then also during the heat, we can do it, and there is no subsequent consequences. But in bitches, there is an increased risk of intraoperative bleeding, not especially at the ligature of the ovarian pedicle, but I would say that it's more frequent that the uterus is cut with the ligature and it bleeds. So I prefer not to do it, but in some cases that the people want to do it, we can do it. In cats, it's absolutely not a problem. You can sterilize queen in heat, and it's not a problem at all. And finally, we can also perform an ovariohysterectomy at the time of C-section. It has absolutely no consequences on the prolactin secretion or on the lactation of this dog or cat.
Thanks, Fernando. Related with that, with the good moment to sterilize the dog or the cat, the next question is that if doing it before the puberty, it has some benefits for the animals or not?
Well, it has because of the risk of the mammary tumors. It has been said that is the earlier we spay them, the better it is. In fact, there is, well, of course, that is the main advantage. That there is almost zero risk of mammary tumors if we spay before the first heat. And it's very useful to control cat colonies, and also if they have never been in heat before, the surgery is easier. However, there are clear disadvantages. The exposure to LH it will be greater because it will be for all the life of the animal, and it has not had any effect of the sex hormones on the tissue. Then there is an increased risk of joint disease, or as we previously seen, in the rupture of the cranial cruciate ligament or hip dysplasia in female Labradors. And there's effects on behavior, an increase in phobias and excitability and aggression in already aggressive puppies. And there is, because of the lack of the influence of sexual hormones, there is an underdevelopment of urogenital apparatus that predispose bitches to develop vaginitis, and as we said, post-castration urinary incontinence. Finally, tumors. It is very variable in the rest of most of the tumors, but for osteosarcoma, there is a clear increased risk in sterilized Rottweilers under the age of 1 year. For the urinary incontinence, there is a publication already a bit old that it says that when for the bitches that are sterilized before the first heat has less frequency of urinary incontinence. We said that it was about 20%, and the dogs was in that case it was 12%. But if they have urinary incontinence, is more grave, more important. A more recent study says that if the dog is more than 25 kilo at the adult age, there is an increased risk of urinary incontinence the earlier the sterilization is performed, up to 1 year. And there is no influence in dogs under 15 kilo. So we can say that there is a protective effect of delaying the sterilization because of the effect of sex hormones on the genitourinary tract.
Okay, thanks, Fernando. Let's let's answer another question that it's quite common. That it's if the sterilization should be combined with a mastectomy or not. What's your experience in this question?
Well, we must, yes. In most of the cases, we should combine the ovariectomy to the mastectomy, because when a dog has mammary tumors, there is an increased risk if it's still intact. There 64% of them will develop new mammary tumors. So the difference is that if they are sterilized at that moment, only 36% of them will have mammary tumors again. And well, in that paper said that 21% of the female dogs with new mammary tumors were euthanasiated. So yes, we should do it unless it's a tumor with clear criteria of malignancy. remember that the tumors, benign tumors, have an important level of progesterone and estrogen receptors, while malignant tumors have no or almost no receptors for that hormones. So yes, we should do it at the same time with mastectomy in the intact pitches.
Okay. Thanks, clear, Fernando. So, well, now until now we have been talking about sterilization, advantages, disadvantages, the best technique. But I would like to ask you which medical alternatives we have to this sterilization. So, I don't know. Maybe you can share with us your experience and which alternatives we have to that.
Yeah, well, traditional products, estrogens or progestogens, are not recommended anymore. Maybe we can use in some case very specific, we can use progesterone, but in general, we should not use estrogens or progestogens because they increase the risk of progestogen-dependent disease. Uterine and mammary disease. However, now we have the slow-releasing implants that are useful. In general, we can say that the efficacy lengths in dogs, it lengths from 6 months to 2 years, depending, especially on the size. It's not sure, but most of the small dogs, the efficacy is longer than big dogs, and in cats it lends for about a mean of 11 months, but it ranges from 6 months to 3 years. So it's important to keep that in mind. In males, the suprelorin, or the only that is commercialized in Europe, is very interesting, but it's important to know that the dog or the cat will not be castrated until 3 to 4 weeks after the implantation. And personally, I use it often when the people is still it has a doubt on the definitive castration, and they want to see how it affects to the dog, and especially for the hypersexual behavior. Then it has also a very interesting. It's very interesting also for cat breeders, for the cats, for the males, and also for the queens. But in males, we have to say that it's important to prevent that it may last for 3 years, so that they must keep that in mind, that the effect can be pretty long. In the female dogs, it's not so interesting. I don't do it. First, because it has an initial induction of estrus, so that is interesting to induce the estrus if you want to breed them. I mean, it has an interest depending on the case. But of course, if we want to prevent the heat, and the first thing that happened to the bitch after the implantation is to have a heat, so it's already that it's not good. And then there is a risk of worsening some subclinical genital conditions, as glandular cystic hyperplasia could develop a pyometra, and also if there are some cases of ovarian cyst just after the implantation. Moreover, especially for cats, if you put an implant and there is an early gestation that you cannot feel by palpation or with the ultrasound, some cases will abort, but all of others may persist the pregnancy. So be careful with that. For the female cats, is more interesting than for the female dogs. Can be used also. Then there is also some papers for, well, about in 2010 or 12, there were some interest on the melatonin administration in cats. It can be done with melatonin implants, and they are used to induce the heat in sheep, in sheep. But the efficacy is about 1 to 4 months. And the good thing is that it has absolutely no effect on fertility. But don't be absolute. It's not 100% of infertility or sterility. So be careful with that. It can also be given by tablets. There are melatonin tablets are sold in parapharmacia, but it must be given daily, and it has also variable effect. So I think the melatonin had an interest some years ago, but now is not anymore.
Thanks, Fernando. Let's start the last question. So the last question is that when the gonadectomy is recommended in dogs and cats.
Yeah, that is the final question, no? So what we have learned during all that time or that lecture, if we have learned something. So, well, first, the easy is for cats. In cats, ovariectomy or gonadectomy has numerous advantages and few disadvantages. So we must spay all the cats because there is almost no problems with sterilization, and it can also be done without problems, the prepubertal sterilization. From 6 to 8 weeks, they can be very young and they will not have problems. But should we spay at 6 weeks? I would say that in most of the cases, we don't need to do it. For indoor cats, so medicalized cats, we can wait easily to 4 to 5 or even 6 months without any problem to finish the vaccination, to finish the deworming, and to let them to grow a little because it's always safer. The anesthesia, maybe the anesthetist they say no, but I always feel more comfortable with a cat, adult or pretty adult, than with a cat of 6 or 8 weeks. For feral cats, it's different. As soon as they can be captured, they should be sterilized. And for the limit for the males is to palpate the testes. And then for refugees or shelters, they should be spayed before the adoption if they have not been spayed before. For dogs, it's not an easy decision because there is not a single good option. For male dogs, I would say that the main interest of castration is only behavioral. In case of hypersexuality, the rest of the case is not very important to castrate them. So I think it's better to let them intact because it will reduce the risk of obesity and the insidious disease. For female dogs, the main problem is the mammary tumors, I would say, and also pyometra, but especially mammary tumors because they can die of a mammary tumors. Pyometra, they can also die, but it is supposed that we are only talking about medicalized and under control females. Then there is a risk of the head and also the cost, because the first thing that the owners told you when you say that you must perform a radical mastectomy of one or both mammary chains and also ovariectomy, they say, "Oh my God, I should have done it when they were younger." and it will cost me a lot. Yes, it has a cost. Maybe they have, because of that, they have not had, I don't know, joint disease or something like that. That could be horrible for the dog. But they keep in mind the cost of that. So to have something, I think the most interesting is the publication of Hart, because that guy is the person who has published the most and who has been shown the biggest interest in that topic. And for the breeds, he has published the recommendation on 35 breeds. It's free access on internet, so you easily find it. And see that for many of them, they give you a choice. So it's not a clear advantage or disadvantage to spay or to gonadectomize at any age. But for some of them, they tell you after 6 months, after 11 months, after 2 years. And it's different, or pretty different, or a bit different, sorry, between the males and the females. So if the breed is here, that they are the most typical breeds, I think it's a good thing to have that table in mind or somewhere in the clinic to follow that recommendation. For mixed breeds, he has also published another recommendations depending on the weight, and look at that a bit different. But for dogs under 20 kilos, he says that there is no influence. You can spay them when you want, but after more than 20 kilos, they must have at least 1 year in the males, and for giant dogs, it recommends you in males to castrate after 2 years, and in females, he says that at minimum 1 year old after or for females of more than 20 kilos.
So thanks, Fernando. I think that we have been learning a lot during this session about sterilization. So as I said, it was the last question, but I have my last request for you. It's, what I would like to ask you, if you can help us to summarize the home messages that our attendees should remind about sterilization in dogs and cats.
So we should sterilize all the non-breeding cats and all the shelter animals, and also the dogs with access to outdoor, for this population control. That is for sure. Then talking about the medically managed dogs, of course, there is this hormone-mediated disease, so variant mammary tumors and pyometras, that for sure there will be there, and there is a risk of that. But also there are insidious disorders, as we have talked about before, that also can be very, very important for the dog. So what can we do? Well, it's an individual decision, depending also in the breed, in the sex, and something that we can recommend is these guides of published by Hart and his team. I think it's a good beginning to have individual decision. Then, of course, it's still and will be always a very controversial subject with ethical, health, and also economic concerns, because population control is absolutely necessary. Breeders, cat breeders in general, they want the cats be sterilized. Dog breeders are more reluctant to that, and vets, of course, vets also prefer to sterilize all because sterilization is surgery and needs money, but we have to keep in mind these insidious disorders that can be very important for the dog. So finally, I think that although these last years it starts to have publications and more data, we still need more to study more about that. So, well, I hope all that it has been interesting and useful for you. And, well, I think if you have some question or something that you can, I haven't talked about that, so I will be really pleased to discuss about it.
Thanks, Fernando. I think it has been an amazing presentation. So, well, we have received several questions during the session. So I encourage all attendees just to be connected, because in a few minutes we will come back and we will answer these questions. Thank you. Okay, we are back to answer the questions that we have received. Before starting the questions, I will remind all people that when we finish the broadcast, you can download the presentation. Below on the YouTube description, you can find a link, and if you click on it, you will be able to have the presentation. So, Fernando, let's start with the first question. The first question, it's about vasectomy and uterine tube ligation. The question is if they are an alternative to sterilization.
Well, they are an alternative to sterilization. Yes, of course. Then you will sterilize the dog or the female because they will not have a litter or puppies anymore. But you will not reduce the risk of mammary tumors or of prostatic tumors, perineal hernias, etc. So no, I will not. I think it's not something that we should advise to our clients. I don't do it.
So clear. Let's see the second question. The second question that we have received is that imagine that we have an all female. So in this case, what is better, to sterilize it even it's old, or it's better not to sterilize and just know the risk that we have, well, that this female has a pyometra, for example?
Well, I don't recommend it because if it's a female with 8, 9-year-old, 10-year-old, she, of course, she may have a pyometra. 10 to 25% of them, they have a pyometra, but 75 to 95 don't have it. So no, at that age, I think I don't do it anymore unless if there is a pyometra, so I sterilize them, or if there is mammary tumors and I sterilize that at that moment. But I don't perform a surgery only for that in an old dog. But okay. It's my way to work, not.
Okay, thank you. And the last question we have is that if that sterilization affects sport performance. So what do you know about that?
You mean sport?
Yes.
In theory, no, it does not affect to that. I have sterilized hunting dogs, and they have continued to do it normally, and also agility dogs, and there is absolutely no problem. They continue to work without any problem. Then, if they become fat or that, but most of the working dogs, they are not fat. So no, I think I consider it does not affect.
Okay. So, well, thanks, Fernando. We are at the end of the session. Thanks also to all attendees to join us during this event. Just say goodbye, and I hope to see you in the next webinar. Thanks very much.
Bye.